we do some neoadjuvant trials in the group of Christian Blank, and you see that in stage 3 melanoma patients who were treated with neoadjuvant therapy, that if they get a pathologic response upon ipilimumab and nivolumab, that they have a good survival. So that's a good surrogate marker for outcome for these patients. And however, a few of those patients do relapse and have a disease recurrence after this initial response. So what we wanted to do, because not much detail about the clinical or the tumor characteristics are known, is to dive into that. So of the 3 trials performed at the NKI in collaboration with other centers, so PESTIN, NEO and the BRADO trials, we've looked at the patient who had an initial response and then at subsequent disease recurrence. And this pathologic response is determined based on, it's classified as partial or as a major pathologic response based on the percentage of vital tumor cells in the surgical specimen. So in total we had 142 patients who had a pathologic response in all these 3 trials, and 12 of them had disease recurrence. And we were able to do a multiplex staining of 6 of those patients. We have the paired lesions, so a baseline sample and the sample at the moment of disease recurrence, and then we characterize the immune cells present in the tumor region with help of the halo, and we determined the distance from tumor cell to the nearby immune cell. And for the partial responders, we just had 2 partial responders with a matched baseline and a recurrent sample. We see that the percentage of the immune cells do increase, but that the immune cells lay a bit further away at the moment of disease recurrence compared to baseline. And for the patient with a major pathological response, we see that there's a more diverse pattern, but in 2 out of 4 patients we see a decrease. So there are less immune cells at the moment of disease recurrence compared to baseline, but these cells are closer to the tumor cells compared to baseline. So that's, I think, a nice finding, but it's also descriptive because there's really small patient numbers and small samples, and we don't know in between what would have been the number of immune cells or the distance between the tumor cells and the immune cells during treatment or a moment of response. So yeah, something to look further into.